Hi, it's Ivy Slater, and welcome to today's Slater Success Live. So, for those of you who are watching us live on LinkedIn or Facebook or YouTube, thank you for joining me here. Also, because this is a special series we're doing, you're going to be able to also listen to it on Her Success Story, our podcast. So, those listeners who are coming in at Her Success Story, thank you for joining us here today. You are all getting an amazing treat. When we start this, what I refer to as our nonprofit series, we do this from the week of Thanksgiving through the week of New Year's. And it's our time to highlight leaders in the nonprofit social impact space, leaders who are doing amazing things. And I have to tell you, this is our fifth year. This is our fifth year. And every time we do this big announcement in September, who should we be interviewing? Who should we meet? What should we know? The community comes out big and strong, and I'm able to connect with amazing people. So let me tell you about Donna Cryer. Donna Cryer is the CEO of the Global Liver Institute. She received a life-saving liver transplant in law school after years of living with an autoimmune disease. On the 20th anniversary of her transplant, she realized her expertise as a patient, lawyer, and professional health systems consultant can help fellow patients. And in 2014, she founded the Global Liver Institute. So for those of you who know anybody who has been navigating an autoimmune disease, who's navigated any problems with liver disease or any problems with anything medical, meeting Donna is an amazing opportunity to learn from a woman who's a mover and shaker and doesn't sit back lightly. Donna, thank you so much for joining me here today.
Thank you so much. I'm so grateful to be here.
So you started the Global Liver Institute in 2014, and I read the highlight of it, but let's get the real story. You know, what was the catapult or the catalyst that said, it's time, I'm doing this?
Honestly, I tried very hard not to. I was taking stock on the 20th anniversary of my liver transplant and looking around and trying to be honest with myself. Was I confident that other patients coming behind me who were in the same circumstances as my family and I were, would they have same access to the innovations in medicines and surgery and care that saved my life then and frankly sustain me today? And the answer was no, because most people have never heard about anybody with liver disease, or they think they don't know anybody who has had a transplant, who has gone through the series of issues that I had. And there was certainly insufficient advocacy and attention for us. And so I made the decision that I guess that's what I was going to devote my life to, or at least this portion of it.
So, you know, when did the liver issues start in your life?
When I was in 8th grade, I was 13 years old, probably earlier, actually. I was, when your best friend is the school nurse, something is probably wrong.
Ding dong, there's a problem.
Yeah, so Nurse Deedle and I were close, we were tight, and God bless her. And so I always had, tummy problems. And so when I was on spring break in 8th grade, I wasn't able to eat. I wasn't able to drink anything. I was rapidly losing weight. And I was admitted to the hospital, and I was diagnosed with inflammatory bowel disease in the hospital. And in some ways, it was a relief to finally know what was going on for many patients.
What was going on? What the reals? That it wasn't some little, a child going into the nurse saying, my tummy hurt, my tummy hurt, my tummy hurt.
Right. But this was a real disease that they knew even at that point, the trajectory was that I could develop colon cancer, that I may need a liver transplant. They didn't know, but every avenue ended in something quite dire. And so it was very serious. And it weighed on my parents as much as or more than me at that point. Certainly, I just was missing softball practice and wanted to get back to school.
So you were very fortunate as a child too. Your parents navigated the health system, for lack of a better word, right? You went on to college, you went on to law school.
Mm-hmm.
You built a pretty dynamic career. You weren't a lawyer for a day and walked away. Let's hear a little bit about, because it shows, I want our viewers, our listeners, to hear the fortitude that you showed up with when you started building out the Global Liver Institute.
I was in law school by the time my autoimmune disease got so, life-threatening that I needed to have my colon removed and then the liver transplant. So I took a semester off. And then I went back to law school. I'd already graduated from Harvard and had, very kind and accommodating, roommates who knew sometimes I would have up days and down days. But I graduated from Harvard, had gotten into Georgetown Law, and
a rather accomplished woman.
Yeah, I was doing okay. It's I have an amazing class. I need to give a shout out for the women of my Harvard class of '92. We now have within our ranks Governor Mara Healey of Massachusetts, the Great Commonwealth of Massachusetts. We have Supreme Court Justice Ketanji Brown Jackson. So Harvard class of '92 is not doing too shabby. So I
powerful group of young women at the time.
Exactly. And the men are okay, but the women of the class are doing really well. So when I look at my accomplishments in that light, I'm still trying to put in extra work. I'm still trying to, we have standards. So the fact that I took a semester off and returned to law school seemed like the only right thing to do. I was recruited into the Justice Department for some groundbreaking work I had done in applying law to an internet environment. That's telling a bit of my age because it was new at the time. And so I worked in the criminal division at Maine Justice in the Department of Justice. And that was really my dream job. And I was... my team teases, they're like, oh, if you have to find out she was a federal prosecutor, the discussion is not going in the right direction. So that does come out from time to time. But I had stayed, of course, in such close contact with my liver transplant team and had observed in my many, many days, weeks, months in the hospital that perhaps things could be done better in the transplant system and in healthcare overall. And so they introduced me to the United Network for Organ Sharing, and we created a job for me that was one part. And there are going to be a lot of parts here. So don't doubt my math on this. So I'm not saying halves, but one part.
We're not going to go into the deep weeds of the numbers. We're just going to look at sections.
Sections, that's right.
Sections.
It was one part federal affairs. It was one part communications. It was one part supporting the general counsel. It was one part supporting the patient education team. It was a great learning experience. And it was also a wonderful way for me to give back and to make sense of my own experience going through transplant and to plant the seed of wanting to do more for others. But it also taught me that, this healthcare thing, always have a career. There are no end of problems here in healthcare. So
very true.
So after 4 years there, I went on to a series of jobs in oncology, revenue capture management. So running, cancer practices and talking to hospital CEOs and chief nursing officers, and ended up at a global public relations firm and helped rebuild that practice, and then built a multicultural division of a clinical trial recruitment firm. So by the time I was thinking about what I could bring to the field of hepatology, the field of liver disease advocacy, or liver health advocacy, as we now like to think about it, I had a lot of skills. It makes sense in retrospect, is what I say about my career, but I really just was following my path and passions and my curiosity and opportunities as they came along.
And I just want to do a shout out because I think it's important for all viewers and listeners to be aware exactly what Donna's saying here. She followed the path of passion and curiosity. So often when we are looking at the younger generations and they're thinking, what should I do? Follow your passion, follow your curiosity, and trust. And, it sounds to me that you trusted that process and did great work while you were there. That when
that's the point.
Came.
Yeah, and that's the point. You have to do great work while you're there. It was really important for me, I think doubly important, because I still was living with a chronic illness and had ups and down, days that I had to be more than excellent. I felt to sort of make up for sometimes, Donna needed to go to a doctor's appointment, or Donna needed to take a week and go to the hospital. I wasn't quite as stable as I am now. And so I talked to a lot of young women in particular who have chronic illnesses and are wondering, do I disclose it to my boss? Can I have a career? How do I have the conversation? And I say, well, you do have the conversation, but it's much easier to have the conversation when you have a portfolio of excellence and of consistently excellent performance to be able to balance your health issues with.
And I think that's important. I think no matter what we take on, we show up at 100%, with 100% commitment, and we show up at 100%. And then where there are any courtesies that are needed.
Right. I think that's why I remember distinctly there was a coalition that we were putting together. And I was so instrumental to it that when I needed to take a doctor-enforced 2-week break, I was thinking they'll have it all sewn up by the time I get back. I'm going to miss out. They just held it. They were like, well, we were just waiting until you came back. And so 2 weeks later, there was not a change to the PowerPoint. There was not another person recruited. They were just sort of like waiting for me to.
Because they value.
Because I was just that valuable. Whether they valued me or not, I was just that valuable. It was making such a difference to the client, to the relationships of the people we were bringing in, to the words and the language that we were using, to the knowledge and substance of the project, that they really had no choice but to wait until I came back. And so make yourself just that valuable.
Make yourself just that valuable. That's what we refer to as a writer downer. Make yourself just that valuable.
Yes.
So 20-year anniversary, the light bulb goes off.
The light bulb went off because I had tried to volunteer with other organizations. I had tried to sort of, help around the edges, write a check, volunteer on a committee, nudge something along, plant a seed, do an idea. And there really just wasn't an organization that I felt had the urgency of the patient needs that I was seeing and had the business acumen to scale, to be at the level of, the other nonprofit organizations that I, love and admire and have the opportunity to work with, that I had consulted for a time. And so I was like, would patients with these sets of conditions, because there are more than 100 types of liver disease, but all of these conditions, why should they suffer? Because there isn't effective advocacy. And so it was really only after doing that really deep dive and understanding the landscape and looking under every, rock and leaf and trying other avenues that I really had to come to terms with the face that if it was going to be built, I was going to have to be the one to build it.
So I have so many questions, Donna. So let me start here for a second. Okay. You and I have had conversations, and one of the things is, wow, starting a nonprofit isn't for the faint of heart. Starting a nonprofit is not a hobby.
Right.
You know, you are CEO, right?
Mhm.
That's
Yeah.
woman in charge, chief executive officer.
Mhm.
It's so easy to just say, oh, this is such a good cause. We'll raise some money. We'll do some good.
Mhm.
You didn't approach it like that. You really approached it as a business. And it's not easy to start a business. It's not easy to start any organization, let alone one that you are truly emotionally tied to.
Absolutely. And I had to take a step back, frankly, from the type of liver disease that personally affected me and really be thoughtful about what were the greatest needs in the field. What diseases had the highest prevalence, had the highest economic impact? What would be early proof points of an effective organization. And so the Global Liver Institute is organized around councils, which do take advantage of my experience building coalitions. And we have councils in liver cancer, in fatty liver disease or NASH, and pediatric and rare liver disease, which is the type of liver disease I have, but that's not where I started, because it was more about how do we build a sustainable advocacy infrastructure for the field, one that can identify problems and array people around them and set an agenda to solve those problems based not just on the skills that I have or that I may hire for, but the skills that the entire field possesses. And so that was a very different approach. We have a lot of organizations who convene now with us who have taken a more traditional approach, which I absolutely respect and which has been effective in raising funds, whether it's from bake sales, walks, galas, golf outings, for research. And they may work with one institution, one researcher, particularly if it's a rare disease. And they are making a difference. I can help them make a bigger difference by uniting them, by helping them solve problems that I see affect many organizations like them, and connecting them to resources that they might not otherwise know. And so for the Global Liver Institute, our success is less about a program or initiative that we do, but has the field as a whole advanced? Is there more research dollars overall for liver diseases? Are we more powerful on the Hill or in a regulatory environment? Not for my disease, but for the field as a whole. And that means bringing along the physicians and the payers and other stakeholders at the same table. We weren't quite accustomed to patients sitting at the heads of those tables, but now they appreciate
and so one of the things I so admire about your organization, it has this patient first centricity, right?
Mm-hmm.
It's patient first centric.
Right.
And as much as all the research is important in the labs and the studies and in the science, there's so much to learn and help from learning from the patient's point of view.
Absolutely. And the heart of our organization, certainly my heart, is our Advanced Advocacy Academy. And so training other patients and caregivers to sit in all these spots that I have been privileged enough to sit in now, or roles that in many cases I've been the first, but hopefully will not be the last. And that they know that they're not just there warming a seat. I may have said at one point that we're training assassins. People were like, what does that mean? I was like, I want them to be the most dangerous person in the room. Nobody will ever think the patient is the most dangerous person in the room. I know I am. I want them to be the best equipped. I want them to have the best ideas. I want them to have the knowledge, substance, the methods, the approach to be the most effective person in whatever room they sit in. So it's beyond just knowing that they belong in there, knowing that they can make a contribution. I want them to be the best person in the room.
So to have a very strong seat at every table.
Yes. I remember during my first FDA advisory committee meeting, when it started, the physician sitting next to me turned to me and said, "I don't even know why you're here," which was so kind.
I'm sorry. I couldn't hold back the emotion. I couldn't hold back the face.
So kind, so welcoming, so open. And by the end of it, he was like, "Can you come up to my center? He was like, can you do all the things? We were partners. He was on team patient. And so I love those transformative moments. I love, going from being, my team now, quotes this sort of scene from Ted Lasso where he talks about being underestimated while he shoots darts right at the center. And that's
Correct.
what it is to be a patient, in all of these situations throughout healthcare, whether it's on the board of the hospital, or I sit, or an FDA advisory committee meeting, or reviewing grants. Nobody thinks much of you. Nobody thinks or thought much of this patient advocacy organization that I had built until I realized that I could shut it all down and they couldn't move without me. So now we can have patient-centered conversations, not where patient is like at the center, like we're a target of things, but where the whole exercise of whatever we are doing, whether it's in research or care or in policy, is organized around what do the patients need as we define it, as we are sitting there with the other stakeholders defining it. And so that's when it becomes exciting, because otherwise, who is healthcare for if not for the patient? Well, the incentives haven't been, yeah.
If we don't look at the patients, why is there, right? It is about the patient. It's the health of the patient, the wellness of the patient, their life, they're moving forward, and then what the healthcare system can do to support that.
Right. And it's not for publications and it's not for profit, although we have both. And I understand both. And so one of the wisest
Well,
things.
it goes back to what you said earlier of there being segments.
Right.
And we need all the segments,
Mm-hmm.
but kind of like the patients get a double segment.
Yes. And I think it's important.
Maybe even a triple.
Maybe a triple. Well, we get the veto power. We get the first and the last word. But I think, and it's a weighty responsibility. And I think we need to be worthy of it and prepared, either with understanding how to convey the strategic nature of our lived experience. So strategic storytelling, to learning, methods. And so our Advanced Advocacy Academy is less about me imposing what I think, GLI wants someone to learn. And it's certainly not about, pimping people's stories to roll them up on the hill. It's really about matching what were the pain points in your journey. And that becomes my to-do list. Those pain points become matched with your professional expertise or your passion. And how can we equip you to address what you found troubling the most within the system? So whether that's a hospital issue or an organ procurement organization issue around organ donation, or a cancer center flow and structure issue, or a navigation issue, or a health insurance issue. And how can we equip more patients who have our conditions to be able to address those? And so when I think about the 200 people who now seed the ecosystem, who have come through our program, that's my legacy, and that's my power. I'm in the business of growing people. I'm in the business of growing advocates.
So let's talk about this for a moment, okay? You are currently in 3 countries.
We have
or 3
offices.
cities?
We have offices in 3 countries.
You have offices in 3 countries.
Yeah, we have partnerships in more than 70.
So how are you doing this? Okay, so let's talk about, nonprofits.
Yes.
Let's be real. Viewers, listeners, let's be real. Nonprofits are business, and the most successful nonprofits are run as businesses.
Yes.
Okay.
Yes,
So
we have the
how
urgency.
How are you accomplishing this?
We accomplish, we measure things. So we measure impact. We have goals.
Metrics is what I'm hearing.
We use metrics. We use data. This isn't about, hearts and flowers and trying your best. We have, team meetings. We have strategic retreats. We think about, the year, the month, the week, the day, even in terms of optimizing our own performance as individuals, as part of the team, as part of departments, as part of now the larger organization. I think very deeply about making sure that everybody who is a member of the organization knows how their work feeds into the larger work and mission of the organization, and how their work impacts patients and families, even if they haven't been a patient themselves. And we do have many patients or family members within the staff, as we do on our board. But even for those who don't, how can we make sure that they know and see and feel how their work is impacting people? So that's an important part of growing a culture that transcends global growth, creating a GLI culture that can be transmitted as we grow, that can be transmitted remotely, that can be transmitted and translated into the multiple languages now that our team speaks. And so that is more of what my job is these days than, the nitty-gritty of, writing a program or a proposal, but making sure that every member of the team understands what GLI means to them, what it can mean to people, and know that they are part of that growth.
So the future. Okay, well, we have a few minutes left.
Yes.
What is your vision? And we're coming to, end of year. We have strategic planning going on. We have visioning for, 1, 3, 5, 10 years. Your vision, where you see this going next?
Our vision is to be closer to communities. We launched our Center for Liver Health Equity this year, which really just pulled together all of the work that we were already doing to make sure that liver health and liver services were accessible to everyone. And so in 2023, the best way to help us is to be able to help us build capacity so that we can be serving local communities better. We can give small grants, for example, to do a town hall in Cameroon that has already changed how they've been able to negotiate about hepatitis B drug and make that more available in their community. And
That's
so
a big deal.
Yes. And so we can do so much with so little that has an impact for so many of the 1.5 billion people who are living with a liver disease. And so that's what I'm excited about, that how much we've already grown, how many people we've already touched, in the number of languages that we've touched them, and we can do so much more. And so that's what I'm excited about for next year.
And I'm just going to say, I'm just, a regular person. As my mother would say, that's true. Right? Thank you. Just a regular kind of person, right? And I can think in our conversation, 3 people I know who have some sort of liver disease.
Yeah.
So when it's that easy in just our conversation for me saying, oh, and this one, oh, and this one, oh, and this one, different areas, different situations, And probably that's the tip of the iceberg of the people I know.
Right, right. And even if they don't have liver disease, they have a liver. And so their liver health is important, and we want to keep them from ever having a liver disease. And so, we have, we're working with parents, pregnant people, infants with liver diseases, grandparents. It really is everybody. And so our liver health is public health. I think I'll know that we are successful when conversations like this about liver health are as normal as having conversations about heart health or brain health. And that's what you talk about around the Thanksgiving, table. And so that's where we want to go.
So if there's one tip you can give our listeners and viewers today.
The tip is to, I think, do what you just did. Recognize that there's probably raise the issue. Ask the question. Has anybody had, a problem with their liver? And then listen, and then connect them to us. That's really it. It's amazing the number of people who see my liver lady license plate or overhear a conversation about liver. I've had conversations in parking garages and in the CVS aisle. Everybody, it doesn't have to be the secret. Let the secret out. Let the secret out.
Let's talk about our liver health.
Yes.
As a proactive approach.
Yes.
I love that. Well, Donna, thank you for joining me here today on Slater Success Live and her success story. And most importantly, happy Thanksgiving. A lot of gratitude to you for coming on during vacation.
I'm grateful for every day of the 11,000 some since my transplant. I'm certainly grateful for Thanksgiving and thankful for you and this platform. The crossover episodes of any superhero are always the best episodes anyways. So this has to
So listeners and viewers, here's a couple of tips coming in, okay? This is getting posted on LinkedIn, on Facebook, on YouTube. Let us know what was most important to you, what resonated, what your takeaway was. And then take that breath and say, what can you do about it? It just takes one small action that makes a difference. So make a difference today. Donna, thank you again for joining me and wishing you and your family a wonderful holiday season.
Thank you.
And viewers, stay tuned next week on December 1st. We are interviewing Michael Osa from the Crohn's and Colitis Foundation. Interestingly enough, I know a few people with that too. We all know people with things. This season is about reaching out, making a difference. Education is a way to make an impact. When you learn something, share it forward. I appreciate you for sharing these episodes forward. See you next time.